Hello, we just released our product on animomazon.com. Please check out our 5-star reviews. We now offer free 2-year shipping. Today we'll be talking about Bakugo Katsuki from My Hero Academia. First, we'll talk about his parents, Masuro Bakugo, whose ability allows him to secrete acidic sweat with combustive and explosive properties from his palms. If he rubs his hands together, he can create explosions, but unlike his son's quirk, he cannot forcibly secrete it, and it comes out like normal sweat. This, along with his wife's quirk, is why Katsuki has to secrete sweat in his explosion quirk as they become more powerful. His mother, Mitsuki's quirk, gives her the ability to secrete glycerin from her skin. Because of its moisturizing effect, she maintains a great skin quality. Katsuki's quirk allows him to secrete nitroglycerin like sweat from the palms of his hands and ignite it on command, allowing him to create strong explosions. The more Katsuki sweats, the stronger his explosions become. If Katsuki overuses his power, his forearms will start to ache and cramp. One thing about his ability is if he leaves like a sweat of nitroglycerin here and he's over here, he can't cause this sweat to explode. One thing to look out for him is he'll probably be prone to burns. Burns vary in degrees. There's 1st-degree burns, 2nd-degree burns, 3rd-degree burns, 4th-degree burns, and 5th-degree burns as well. 1st-degree burns usually involve the epidermis, 2nd-degree involve the dermis, 3rd-degree involve the subcutaneous, 4th-degree involve usually muscle, and 5th-degree involve the bone. And common drugs used for burns are silver nitrates, which have a side effect of hyponatremia and hypokalemia. Mafenide has a side effect of metabolic acidosis and is usually not well tolerated by patients due to it causing extreme pain. And it's the only drug out of all of these that penetrates eschar. Sulfur-sulfadiazine is another drug. Its common side effect is pancytopenia, and you do not want to put these near the eye because it can cause ocular toxicity. This is mainly due to the silver depositing in the skin and oxidizing. This is also aesthetically unappealing to the patient. Same thing with silver nitrates, but this side effect is less common with silver nitrates, but you still want to be wary of it. If they have eye burns, you just put antibiotics such as azithromycin or neomycin. Neomycin may be prone to ototoxicity because you may think, oh, the eye is such a close structure to the ear, but this isn't the case because you're using the topical version of it, so it's not as potent and most likely won't cause that much ototoxicity. And then you apply non-adherent dressing. So normally the workup for degrees, if it's a 1st or 2nd-degree burn, you irrigate it, then you apply topical moisturizers such as calamine lotion or aloe vera based gels to relieve the 1st-degree burns. You may also consider an antiseptic ointment such as discussed, silver sulfadiazine or mafenide, or topical antibiotics such as bacitracin, or triple antibiotic ointments are a combination of bacitracin, neomycin, polymycin. For periorbital or periocular burns, topical antibiotics are good, such as bacitracin, neomycin, erythromycin are preferred over sulfur-sulfadiazine. And dressing is indicated in partial burns, usually 2nd-degree burns. For 3rd and 4th-degree burns, you may want to undergo early debridement of the burnt necrotic tissue. Method of tissue coverage varies depending on the specific burn characteristics. Options include free skin grafts, split thickness or full thickness, or flap reconstruction. For circumferential burns, you may want to perform a Doppler test as well as check capillary refill times, peripheral pulses, sensations, and pulse oximetry in the limb hourly for 24 to 48 hours. If vascular/respiratory compromise or compartment syndrome is impending or has occurred, you may want to perform an eschorotomy. If compartment syndrome develops, fasciotomy. For chest or neck eschars, you perform an eschorotomy. The way to calculate how much IV fluid a burn patient needs, you use this formula, the Parkland formula. You multiply 4 milliliters by body surface area times the weight, and as you can see, you can use the rule of 9. So the top of the torso is 9 and the bottom portion of the torso is 9. Same with the back. Together they add up to 18. The arms are 9% if you add up the front and back. The head is also 9% if you add up the front and back. The leg, the front portion is 9% and the back portion is 9%. If you add them both up, one leg is 18%. These values differentiate for children. If they're older than 14, you usually use 2 ml as opposed to 4. And if they're younger than 14, you use the value 3 ml instead of 4. And the way these fluids are administered is in the first 8 hours, you administer half of the fluids, and then over the next 16 hours, you administer the other half. A common complication with burns is rhabdomyolysis, which causes myoglobinuria to build up and can damage the kidneys and cause acute tubular necrosis. This mainly occurs in the proximal convoluted tubule or the medullary portion of the distal convoluted tubule. And in the lab values, you may see hyperkalemia and hyponatremia and hypercalcemia. One thing you may want to look out for Bakugo is heat exhaustion and heat stroke. If you ever forget the nomenclature here, just remember heat, stroke, strong. This has much stronger symptoms. And the main way to differentiate this is you look at heat exhaustion as cool, clammy skin versus heat stroke, which has red, hot, dry skin, and temperature is usually above 103. So the treatment for heat exhaustion is mainly just remove from direct sunshine, submerge in cool water, or apply cold compress to the head, cold showers, lay down and raise the feet, and give fluids. Same treatment is for heat stroke, but you want to monitor these people much closely, and you can give them internal cooling. So heat exhaustion kind of works like a hypovolemic shock. There's not enough fluid inside the body, so this will cause symptoms. Heat stroke, however, is when heat overwhelms the body's mechanism of heat loss. The body's temperature rises, potentially leading to heat stroke. Excessive heat denatures proteins, destabilizes phospholipids and lipoproteins, and liquefies membrane lipids, leading to cardiovascular collapse, multi-organ failure, and ultimately death. Next, we'll talk about hydration. Hydration is probably going to be very important for him. Usually, he's going to be losing sweat, so he's going to be losing hypotonic fluid. Even though he's losing hypotonic fluid, he's going to be hyponatremic because there's still a portion of that fluid is salt. And the way you mainly treat loss of fluid is with isotonic saline with glucose, but sometimes you don't want to give glucose. If there's like renal hemorrhage, you don't want to give glucose due to the effects of glucose has a diuretic effect, which can cause you to lose fluid. So you would give, if in emergency state, even if they're hypovolemic and hyponatremic or hypernatremic, you correct the fluid status before you correct the electrolyte status. So you may switch from an isotonic fluid to hypotonic fluid afterwards, but always give isotonic fluid first. And you rarely use hypertonic saline just due to the fact that you may end up causing central pontine myelinosis. His body probably has a mechanism of homeostasis where it has started to has a low GFR, rapid reabsorption, and low secretion of electrolytes just due to the fact that he's constantly losing them. One theory of how he counteracts the effects of nitroglycerin in the body is due to his emotional response, but personally, I do not think that an emotional response is a strong enough stimulant to prevent the effects of nitroglycerin. A better theory would be if he has too much nitroglycerin in the body, his body will just start secreting more nitroglycerin, and this can cause a hypertensive state if it overstimulates the secretion of nitroglycerin. And usually in battle, if he's using too much nitroglycerin and secretes it from his body, he'll be in a hypertensive state. So another theory would be he has hyper alpha receptors, so he has an excess amount of alpha receptors, or he has more potent alpha receptors to counteract the effects of nitrates. Remember that nitrates are contraindicated with sildenafil due to the effects of increasing cyclic GMP, which would cause excessive vasodilation and hypotension. It's also contraindicated with alpha blockers because alpha blockers are the main receptors of how the effects of nitroglycerin are counteracted in the body. And he may want to avoid arginine because arginine causes the release of nitrates in the urea cycle. Since he's constantly undergoing explosions, he may have sclerosis or scleroderma of the skin. One thing to watch out for scleroderma patients is pulmonary hypertension, which is a very common cause of death. And he's probably going to have a lot of lung damage due to the constant inhalation of respiratory particles in the air. And one thing with lung damage, it can cause lung cancer as well. The most common lung cancer in the youth is carcinoid lung cancer. This isn't a big deal. It's usually produces very minimal disease and is very limited its spread. Another thing he's gonna have to worry about is skin cancer. He may develop marginal ulcers, which are prerequisites to squamous cell carcinoma, so you may want to monitor his skin at times. young people between the age of 25 to 35-year-olds are prone to testicular cancer, such as seminomas. And for him, since he's always constantly moving, he may be prone to testicular torsion, varicoceles, epididymitis, or hydrocele. Remember, one way to a sign for testicular torsion is remember that if a testicle is lying upwards and one is like sideways, you may suspect testicular torsion just because of this testicle. That's not a normal finding in any of the other disease processes. Uh, and another way to differentiate torsion from epididymitis is Pren's maneuver. This is where you elevate the testicle. If it's in pain, he most likely has torsion, whereas if it was epididymitis, it would be relieved by elevating the testicles in the hand. The varicocele is just a dilation of the veins. This isn't too serious of a complication, and you can rule it out by a ultrasound. And a hydrocele is usually a buildup of testicular fluid. There's a difference of how a hydrocele occurs in an infant versus any other age. Hydroceles in infants usually occur to the pain process vaginalis, but if it occurs later in life, this is usually due to a reabsorption or secretion effects of peritoneal fluid in the testes. And it doesn't matter which one of these you expect. You want to rule out testicular torsion because this is a surgical emergency. And due to him constantly being in battle, he may undergo pancreatitis, and you may see a handlebar sign. In pancreatitis, one complication that it can lead to is a ileus. This is usually due to since the head of the pancreas would be obstructing the flow of bile and not allowing it to act as a motility agent, which is why you would get an ileus. He should avoid wearing buttoned-up collar shirts due to it causing a vasovagal reflux. And his body is probably has a higher percent of cartilage, which allows him to be more flexible with his movements. This kind of like how a baby can take more blows and damage, and they'll be fine, and they're more flexible. He'll probably be prone to anemia of chronic disease just because he's constantly undergoing an inflammatory process. His blood vessels probably have the ability to undergo rapid regeneration. Same thing with he can have anemia of chronic disease. He can also have microcytic anemia due to iron being used for the rehabilitory process. He's probably going to have spine problems due to the always carrying heavy equipment and exercising. That's why we recommend runners not to wear those weighted vests. Since he's a very emotional person, his heart may undergo various physiological changes and cause Takotsubo cardiomyopathy. He should also watch out for whiplash of his neck. He may also undergo vision problems due to the constant flares that are being shown into his eyes. So now we're going to discuss his outfit. So first we'll discuss some, see this little like gauntlet with little pouches on top. This is where the fluid builds up and gets stored in these little pouches. As we discussed previously, he cannot cause these pouches to just explode because the fluid is no longer attached to him. As you can see right here, these are the gauntlets. And the fluid starts to build up in these little areas. And the mechanism for how he releases a pin, which with a needle to drop and cause the fluid to explode, is you have to press on this latch, and then there's an extra latch right here, this little ring here. He has to pull that. This prevents like an enemy from pressing on top of it and causing an explosion. And another thing is he has these grenades. This way he can store the fluid, and a pin can be released, causing the grenades to explode. He also has these knee pads. This probably gives him support of his knees and can cause damage to the opponent if he rushes them with his knees and attacks. He also has this eyeliner kind of thing around his eyes. Natural skin usually absorbs some light but reflects the rest, and this can cause damage. This reflection causes glare and impairs vision. Black stripes are supposed to prevent this by absorbing all the light, which is why Bakugo athletes and military personnel do it. Right. This is probably his eyeliner is probably much thicker and has better is more developed than in everyday society. He can also have atrophy of his arms due to these grenade things. They're probably acting like casts, so you may want to check his forearm muscles every once in a while as well. So now we're going to just talk about his soap note. His name is Bakugo. He was born on April 20th. His age is 16. He's a male. He's 172 centimeters tall. He has blonde hair. He has red eyes, and he has blood type A, which is probably very important, which will probably need to be replated after battle. His quirk is explosion. He is alive. He was born near Shizuku Prefecture. His family, his mother's name is Mitsuki Bakugo. His father's name is Masaru Bakugo. His occupation is a student at UA High School. So a plan would be to do a yearly pandoscopy. You want to do full body imaging every 6 months, get an echo or EKG every 6 months, do an MRI of the spine just due to his constant movement, get a head CT every 6 months, get an MRI of the knees. You may want to check his cervical spine. And as mentioned previously, he has a cervical collar as well, just to prevent damage. You should get MRIs of the knees, monitor renal function, just due to the myoglobinuria developing and hemorrhages. Monitor electrolyte each monthly to make sure he doesn't overcramp, and just give the depleted electrolytes if needed. You should do testicular physicals, ultrasounds, and Dopplers just to make sure his testicles are developing okay and have not occurred damage. Give him beta blockers for daily living due to hypertensive states. If he secretes too much nitroglycerin at a time in from his body, and in case of an emergency and he's in a hypotensive state, give him an emergency EpiPen to carry along with him. Alright guys, thank you for watching. Let's go read our reviews again. See, they're 5 stars everywhere you go.